Ladies and gentlemen, thank you again for joining us today. I am super excited to actually have the opportunity to talk to another hero, another individual who's out there putting his life on the line every day. Ladies and gentlemen, I would like to introduce you to Dr. Garth Walker. Hey, brother, how you doing, man?
I'm good. Thanks for having me.
No, we're fortunate to have you. I think we'll just start by asking, like, just tell the audience, tell folks who you are and what you do, man, because you're doing a lot right now.
Sure. So I'm an emergency physician in Chicago. I also do research at the Northwestern Buehler Center of Health Economics and Policy. And I am also the co-founder of Clinify Health. We are a tech analytics platform that focuses on social determinants of health.
So I got to ask, man, I'm going to just jump right in. I mean, clearly what we're seeing now is something that we've never, ever seen before, this pandemic, right? But when I look at the numbers, man, it's alarming, which is why we're so excited to have you kind of walk us through what you think is going on. But numbers in saying that in Chicago, where you're at now, 72% of people who have died from COVID-19 are Black, yet we make up 30% of the population. I mean, that's crazy. Could you tell us why you think?
Sure. So in Chicago, similar to other cities, we're seeing the pandemic fall across racial and economic lines. When I think about Chicago and when I think about the African American population, we have a very, very troubled history with the healthcare system, going back to exploitative research without consent, when you think of Tuskegee, or exploitative research where we haven't necessarily received the benefits with Henrietta Lacks. And then you add on the social and economic drivers. I know redlining and denying mortgages, which was a huge driver to the wealth gap. And even in Chicago, we can have wealth and life expectancy closely tied in the Gold Coast versus the West Side and South Side. It's upwards of 30 years difference in terms of life expectancy. And a lot of that has to do with the persistent healthcare disparities that's been plaguing our society.
So, I mean, can you share with us, like, what are you seeing on a daily basis when you're in your ER room? I mean, what is different from what you'd be seeing there as opposed to any other city in the US or town?
So in our ERs, we're seeing more respiratory presentations, full stop. The virus affects your lungs, makes it very hard for you to breathe. We're seeing more cases of ARDS, which is a very difficult disease to manage. We're seeing a lot less of other conditions because we're all on shutdown. And that gives me pause when I think about our communities, how difficult it is to access the hospitals. My first question is, what exactly are they doing? Are they getting the medications they need? Is innovation, virtual health penetrating our communities that we need them to penetrate to make sure that we can manage these symptoms outside of the hospital when before we were seeing them within our ERs?
Hmm. So I mean, can you kind of walk us back now? Like, what are the most common symptoms that you're seeing people of color come in there with, or what they're complaining about? And how are some of these things being addressed, excuse me?
Yeah, so with respect to the disease, everybody's going to present somewhat similarly. Fever is a common presentation. Dry cough is a common presentation. Shortness of breath is. The difference based on kind of your access, your privilege, could be how late you present. So our communities don't necessarily have great access and they don't have great insurance. And there's a lot of apprehension when you don't have insurance. For example, I was with Chicago Cred, a community health organization that fights violence on our south and west side, and we're repurposing them to educate the community about the pandemic. And one of the first questions that I got was, is it covered? And to me, that's completely unacceptable. This is a public health issue that's transmissible. And the longer we neglect our communities, the longer this disease lasts.
So is it that because of this, you're also seeing that people of color are actually showing up to the hospital way later than, let's say, other folks would, other white people would, because of that?
Well, that probably most likely can explain part of the mortality, right?
Yeah.
If you have a late presentation, it's just much harder to save a person's life. But what I am saying is we've had decades and decades of healthcare disparities, and healthcare disparities research is not new.
Mhm.
is just as well researched as lung cancer, heart attacks. The difference between those two is that it lacks investment. And part of that has to do with the lack of empathy and a lack of us to focus on the role that race plays in our healthcare systems. And the only way we can make any real solutions is if we target that issue and make it part of the plan.
That's such a great point that you make as well, because we had a campaign called hashtag Black Health Now recently, and it was primarily focusing on the fact that, you know, there is a serious issue, like serious bias and systemic racism that is built into the healthcare system. So, and I don't want to put you on the record, so feel free to not answer, but do you feel as though some individuals, when they're going on, people of color going into the hospital, are not getting the appropriate care or attention from nurses or doctors because of the color of their skin? Are not being taken seriously?
Well, bias is well documented. I don't want to say it's intentional or unintentional, but what I will say is, for example, if I'm treating a grandma and she's apprehensive of our healthcare system, I completely understand why.
Mm-hmm.
The history that we mentioned earlier about wrongful research done on our communities,
Yep.
where people got syphilis and they didn't know it and weren't treated. You know what I mean?
Yeah.
When research was done on our communities, and although findings were seen, we haven't been able to get the treatment at the similar rates as other groups. So it's completely understandable if there's mistrust inherently
Yep.
in our communities with the healthcare system.
You had an article that was written recently in the Chicago Sun-Times that actually led with, and it struck a chord when I saw this, because I was like, wow, that is so true. But you had said, as a doctor, how do I tell a Black family of 5 struck by the virus to social distance in a 2-bedroom apartment? Can you tell us a little bit about that article and what you were writing there?
Yeah, sure. So I was talking to a friend and trying to help counsel during this pandemic. Uh, and essentially I was just at a loss of words again for the most part. And the stats had came out the following day, and I just became very emotionally charged and essentially just started writing down my feelings. But what I think as an emergency room physician, we're very well trained to stabilize conditions, save lives, treat patients for the most part. But the challenge will always be for us to understand our patients' lived experiences. So if a patient comes to me and I'm about to discharge them from our ER, meaning I've made the decision that they're safe enough to leave, and their next question is, okay, I'm COVID positive, I have confirmed disease. Uh, how do I manage? And when I have to go back home and there's 5 other people in an 800 square foot apartment, it's very difficult. It's difficult for anybody. And these are issues that are very palpable to our community. And what ends up happening is that we have to come up with uh, solutions that are tailored to that situation. So a lot of times it's me talking to them about, it's like, is there a family member that the person that could be most vulnerable in that setting can go to? Is there any way we can partition the home to make sure that people aren't crossing back and forth and passing the disease throughout the home? Is things like that. But what it ends up showing is that there's a lack of support for some of our most vulnerable communities in Chicago, that's Black and brown.
Yeah. So let me ask then, there's been a lot of, you know, discussion around what's true and what's not true with COVID-19. Earlier on, there were a lot of Black people who literally walked around saying, we can't catch this, right? This is not a disease for us.
Yeah.
Are you seeing similar things out there in Chicago? Are you hearing similar things? Are your patients coming in and saying, wow, I thought this, but that wasn't the case?
Yeah, just like I just mentioned the other day when I was working with CRED, one of the questions that they were fielding from their community, from our communities, South and West Side, was saying that their pigment might be a barrier and might be protective agent against this disease. And clearly we know that's not the case. Or there's some form of conspiracy in general. So there's some debunking on that from that standpoint. So it's some education that we have to make sure that our communities are receiving. And that also includes us telling them about PPE and if they have essential workers, which we're more likely to have, are protected when they go out into our communities. And if they need somebody to make grocery runs, try to have the healthiest person be the same person that makes those grocery runs. So we're not exposing everybody to the virus. This takes a lot of thoughtfulness from that standpoint.
Yeah, that's true, because I will say that I have a significant process when I leave the house, and I am the only person that leaves the house here in my family. And it's like spraying stuff down and getting back to the house and like wiping the car down and like taking my clothes off outside. It's wild, man. But I think that having a process most certainly helps. Is there, there's the other thing that we hear a lot of people talk about is this age thing, right? It's like, I'm younger, I'm older, the older people are going to die, younger people, like, what are you seeing on a daily basis? Like, what does the demographic look like to you, an age group look like to you?
Definitely older. Anybody over 60 is more at risk than anybody younger than that, particularly if you have other medical diseases, diabetes, hypertension, asthma. For the young people, I think if you have respiratory conditions, it puts you more at risk than others. I've seen young people with exercise-induced asthma coming in with low oxygen levels. So it's been presenting odd, but also predictable like other diseases. If you're older, you're just more at risk in general.
Mm-hmm. So it brings up a good point. So what is the most common issues that we're seeing Black people have that are bringing them into the ER room that's allowing you to have to see them every day?
If I had to anchor it, I think honestly it's a buildup. I talked about a lot of those social inequities that have driven to this point. It's pretty much just lifted the curtain on the inequities of our society.
Mm-hmm.
So if you had poor access to care before, you probably had poor chances to manage your medication, manage your chronic diseases. Mm-hmm. So when a situation like this happens, it just comes at you in your face. Mm-hmm. So with respect to the presentation, it's not different by ethnicity. If anything, it's probably different by delay of time or your class or something along those lines. But the disease is the disease. People are going to present as they will if they are sick or if they are not necessarily vigilant about going in early to seek care.
But are there things specific to, like, in terms of the people you're seeing, like, more than others, obesity or high blood pressure or like kidney issues, things of that nature?
Agree. Yeah. If you are obese, if you do have diabetes, you're more at risk. That's for any society. But when we're talking about a pandemic, there's external factors at play, right? Is how well can you isolate? Like you just said, if you can't isolate well enough, you're going to be more at risk to get this disease and come into the emergency room. So you could have those same diseases and live in the most wealthiest neighborhood and have a ton of space in your home. Or you just might be privileged enough to separate and live in your basement. And that will be good to keep you out of the emergency room. Mm-hmm. But when we're talking about proportions and we're talking about what groups are most affected or what group has been or has had the most systemic issues that, associated with themselves as a population, they're going to be more at risk. Yep. Full stop.
So that leads to another question I want to ask is, I do know a few people who've had this and have gotten through it, some who are still dealing with it right now in families, like family full of people. What is the suggestion? Like, for anyone that doesn't have this, right? How do you go home and actually deal with this? Or if I'm calling the emergency hotline and they say, okay, you can't come in to get a test, stay home and just hunker down for 14 days. What would you tell people are the steps to kind of doing that effectively?
So if you think you are COVID positive, you should socially isolate, quarantine yourself for 10 to 14 days. That's essentially how long we think the virus will last on surfaces or within people's bodies. Aside from that, if you live with somebody that has known COVID diagnosis, you should ensure that you're separated from that individual. Continue to wash your hands, wipe down the surfaces that you use and that they use. as well as watch them closely too. Make sure that they're not getting worse with the virus to the point where they need to go to the hospital.
Mhm. But I've been hearing the craziest things, like craziest at-home remedies and drink this and mix that. Is this just like you gotta deal with it, right? It's like, because again, like ibuprofen, I believe, is said to make it worse, right? Is that the case?
Yes, there's not any high-level studies showing that, but there is an association. So the CDC has made a recommendation to avoid ibuprofen in people who are COVID positive, and leaves it to the physician to make the choice based on the patient's health. Uh, but yeah, I think as long as you're able to kind of delineate between the two, you should be able to withstand the disease, but still be cognizant of when you're getting worse.
Hmm.
With viruses, for pretty much all of them, the treatment is supportive care. And so if it's supportive care, we're still doing supportive care through the ER, but we're doing it with intubations, ventilations. We're just waiting for the virus to kind of subside. There's no antibiotics. There's no real treatment. There's no research that shows that we have a solution. There's some research that shows some low-level research that shows that hydroxychloroquine could potentially be helpful. Some antivirals could potentially be helpful and lower the length of time that you have the virus.
Got it.
But there is no like, I take this medication and I'm done type thing.
That's really interesting, man. So I mean, to some extent, I mean, either if I'm at home with it or in the hospital, I have to just wait it out. There's no real remedy, right, for this as of yet.
Well, you have to wait it out into the sense where you notice that you're getting either really, really sick, meaning you're short of breath, just going up a set of stairs, and yesterday you were able to do that very, very easily.
Mm-hmm.
In that case, you probably need a medical evaluation.
Mm.
If you're just feeling like body aches and it's kind of subtle, you can probably wait it out, and that's what some people are doing.
Mm-hmm.
But it takes a lot of insight and as well as a lot of understanding to know that you may not need hospital evaluation versus staying home. But in general, if you can wait it out, the goal is to quarantine yourself from others and wait till the virus subsides.
Mm-hmm. So if there was a list of, here are your things, your 3 to 5 things that you should be doing to stay safe, right? What would you say that those things would be, at least for people of color?
The first thing I would say is the general guidelines. Wash your hands frequently, wash your hands whenever, if you touch foreign objects, especially if you have multiple people coming through the home. If you're an essential worker, make sure you're wearing a mask, make sure you're practicing the 6 feet away guidelines. Take off your clothes before you go in, back into your home. And then the third part, making sure you wipe down your household for when people that may not be in your home usually are using it. And then also thinking holistically about your lived experience, right? So if you have that member, if it's very tight in the household and somebody is very elder and could be very, very much at risk, see if there's any type of housing alternatives within your family network. If there are any government support that is providing delivery networks to help deliver groceries to your home so that you don't have multiple people exposing themselves to the virus. Those are initiatives that we can do that's within our control to help the spread of the virus, but also help avoid exposure to the virus.
Yeah. Thank you, man. I mean, look, this has been amazing. I mean, this has been really insightful for me, and I'm sure for a lot of other folks. Is there perhaps any last word of advice or anything you'd like to give to anyone that's watching right now? Because I think that it's having the opportunity to talk to an ER doctor about this stuff is pretty amazing and insightful for us. So anything you have would be great to hear.
Yeah, no doubt. Well, in my article, I highlight the need for like mass testing of our most vulnerable communities. If we notice that there's an outbreak, advocate for your community, and you know that there's a outbreak and it's very concentrated within your community, make sure that everybody's getting tested, because the only way we'll be able to solve this is if we know where it's at, we're able to stabilize. Also, advocate for social services that need to be directed towards our communities. We deserve it. We need to make sure that there's housing alternatives, and also long-term thinking about employment options afterwards, because some of these jobs may not be there. And then also the behavioral health component, make sure that we're thinking about our mental health. Once a recession will always breed hopelessness. And one thing that I definitely know about hopelessness is that suicide picks up a little bit, violence picks up a little bit, depression picks up a little bit. So we got to be on the lookout with how our communities are adapting and making sure that we have the resources and services directed appropriately.
That was incredible, man. Look, doctor, I appreciate your time. And, I just want to say again that we are fortunate to have people like yourselves who are out here putting your life on the line to help other people and save lives. So you are a hero, my friend. So again, thank you so much for your time and everything that you've done and are
Thanks,
doing.
Walter. Thanks, Walter. Stay safe, man.